So addiction, therefore, is dependency, both physical and psychological, and we must remember that addiction occurs at a physiological level even when it's occurring at a psychological level. That sounds contradictory, but what we want to remember is our behavior, from eating to going to the bathroom to sleeping, is being done because of the way it affects our physiology. It keeps us alive, it keeps us feeling well, and it satisfies the very drives that keep us alive and well. So when we use a substance, we're doing things that are strongly aligned with the human drives that help us to survive. We have within us a strong compulsion, a drive to consume food. Why? Because if we don't, then we wouldn't survive as individuals, and neither would our species. So consumption helps us that drive toward consumption helps us to have nutrition. And interestingly, we can see as we look around North American society that we are so compelled to consume that we often consume food even to excess, and that's why so many of us are overweight. The drive to consume is now an unhealthy drive because it's so easy to access food, a particularly highly caloric food. And so that same drive is very much related to the drive to consume something like drugs or alcohol. We also have drives to seek pleasure, and those may seem like they don't have a connection to our survival, but indeed they do. When we enjoy food, that's part of the compulsion for us to go out and feed ourselves and stay alive. And when we enjoy sexual activity, it's part of the reason why we're motivated to procreate the species. We also have a human drive to escape during times of stress or what we perceive as danger. And again, that drive is essential because without it, we would have long ago perished because we would have stood there like a deer in the headlights while others that wanted to make us their prey gobbled us up. So that same idea is at the root of why a person might use a substance to mentally escape or withdraw from stressors that are impacting them. To the human mind, as we've said earlier, the idea that a bill collector is calling is not substantially different than the idea that there's a bear outside of the cave wall and cave door and trying to get in. They're both threats, and in both cases, our urge is to escape. So I like to paint the behavioral picture of addiction and what we call the functionalism of behavior. And when we look at what makes all behavior functional for us, in other words, the stuff that we use to determine what behaviors we will use, there are 6 criteria. And drugs meet 5 of them, and meet 5 of them extraordinarily well, which is part of the reason why it is so difficult for people to avoid using drugs, especially after they've started. So the 6 criteria for the functionalism of behavior are: number 1, that the behavior has a big payoff. In other words, the more reinforcing the behavior, the more likely we are to repeat it. And this is true of everything from watching a program that we like repeatedly, to playing our favorite sport, to using a particular slot machine in a casino. Once we win on that machine, we're convinced we should keep using it because we got the best prize from that machine. And that is especially true with drugs, because drugs go right past all of our sensory organs and go directly to the brain and communicate with pinpoint accuracy that this is a very rewarding experience. And this is particularly true of drugs like crystal methamphetamine, cocaine, and heroin. They go right to the part of our brain that receives pleasure, and they say, this is literally better than food or sex or gambling or anything else that you've experienced. So it's extremely positively reinforcing because we feel pleasure, and then sometimes incidentally we also feel social acceptance. Maybe our peers are using this drug, and so that's reinforcing for us to be like them, or we do it in a way that makes us feel more bold and more likely to approach a person, for example, of the opposite gender. We're more charismatic, and that again has a socially positive reinforcement effect. But there's also a negative reinforcement effect. And I'm going to take a little sidebar here to let you know something that's a bit of a pet peeve of mine. Negative reinforcement is not the same as punishment. Negative reinforcement is a good thing. Punishment means that something bad happens to us and it deters us from a behavior. Negative reinforcement is something we like. It's the opposite of positive reinforcement only in the sense that in positive reinforcement, we get more of something we like, and in negative reinforcement, we lose more of something we dislike. So for example, if I give you $5, I'm positively reinforcing you. But if I take away your garbage, I'm negatively reinforcing you. I'm still doing something you want me to do, but it's because I'm taking away something that's unpleasant. Or if I help you to avoid or reduce something that's unpleasant, that's also negative reinforcement. And so drugs are also negatively reinforcing because they help reduce physiological and psychological pain. They help us to forget trauma. They help us to alleviate any number of mental health symptoms. They help us to overcome boredom, I should say, and they help us to overcome social anxiety and shyness. So there is a gigantic reinforcement value to many substances. Number two, what makes behavior functional is how cheap and easy and accessible it is. In other words, the more ease with which I can perform a behavior and still get the same result, the more I'm likely to do it. So for example, if I said to you, you can get a ride from me to work today, or you can walk down, wait for a bus for 20 minutes, pay $1.50, and then have to ride the bus for 45 minutes, you're going to probably take the ride from me. It's not that the ride is a better ride, it's just that it's easier and less expensive both in terms of time and money. So this is particularly likely to be reinforcing when we make things cheaper and easier and have a bigger payoff. If I say to you, come with me for a ride and I'm going to buy you a coffee, you're even more likely to do that because not only is it easier, but it's better too. And drugs are very cheap, easy, and accessible for many, many people. For those of us who do not use drugs regularly, it can be mystifying to think about how easy it is for a person to use drugs. But drug dealers these days are very accommodating. They'll come to your home, you call them on a cell phone, and it's as easy to get drugs as it is to get a pizza, and probably in some cases cheaper. So drugs are a very easy way to escape from the realities of life, to create a party at any moment. And so this is part of the reason why, again, they're where people can be very reinforced to use them. The other three things that we want to talk about that drugs have going for them are what we call the contingency of the reward. And what we mean by a contingent reward is that we're more likely to do things if we can see that it will be a positive, that our behavior will have a positive return, a positive effect. And we look to three different things to determine whether or not a behavior is likely to have a positive effect. The first is if somebody just tells us that it will. For example, when we turn on the television and see an advertisement tell us that something will make us feel better or look better or be more likely to attract the opposite sex, it's very effective because if we believe what that message is saying, then we're going to go out and try it for ourselves and see whether or not that prediction comes true. Well, people hear all of the time from others who use drugs that they're going to feel great if they try this drug. And this is part of the reason why peers are such an influence to younger people, because in many cases, the young person who's hearing this doesn't have a great filter for discriminating between good advice and bad advice. And in many cases, they don't know the real dangers of the behavior that they're about to engage in. And so they hear from a friend who's never steered them wrong before that trying something is going to make them feel good. Or they hear it from an older person and they're taught to respect their elders and peers, or elders and seniors, I should say, and so they try it. The fourth one, the same, is also part of contingency, and that is we notice just the exact same way as a dog starts to associate a treat given immediately after being told to do a command, that the treat is associated with that command. We do the same thing. If a reward comes quickly after a behavior, we think, well, the reward must be a result of the behavior. And drugs tend to have a very immediate payoff. They tend to make people feel very, very different very, very quickly. And there's little question, even in the minds of people who are developmentally immature or may not be very advanced in their thinking, that what they did just caused this positive feeling. And the consistency of the payoff is important as well. Once again, if we were training a dog, we not only would want to give that reward right after the behavior the dog exhibited, but we want to do it over and over and over again so that the dog develops a pattern. Well, it works on dogs and it works on people the same way. The more that we become habituated, the more we start to associate the reward with the behavior. And in fact, the less we think about other behaviors that are in our repertoire. So there are five of the criteria that we use to determine if a behavior is going to be a good one. The sixth one that we use is that a behavior has few or little side effects. Now, of course, drugs don't meet this criteria. The use of drugs has huge side effects, huge dysfunction associated with it. So why do people use drugs if they're in fact still having this dysfunction? Well, the answer is that each of us will weigh these 6 criteria differently, but most of us would say if there are 5 good things about something and 1 bad thing, we will probably try it. And this is evident, for example, if you were being told, hey, we want you to try chemotherapy because you are sick with cancer. The payoff of that is that you will be able to live. It's going to be made as easy for you as possible. You're going to be provided with research that tells you that it will work. You're going to be hoping that it will work as quickly as possible, and you're going to hope to see that it works every time that you try it. Even though you know that the chemotherapy will likely make you feel sick in the short term, you're still going to probably try the chemotherapy. And that's a substance that doesn't make you feel good in the short term. So compare that to how a person might use a substance that's intoxicating. Which takes me to the other reason why criteria number 6 isn't always evident to the drug user. Because if we are developmentally immature and or intoxicated, we may not understand the negative effects. If you think about it, if you've gone out and you've consumed alcohol to a great degree, and then the next day woken up with a hangover, the hangover came after the reinforcing experience, the intoxication, the fun, the lack of social inhibition that happened the night before. And so it can be easy to remember the intoxication and harder to remember the side effect, the hangover, the next time. And that's particularly true of people who use substances chronically because they constantly use the substance and rarely are lucid enough or sober enough to notice how badly it has affected them. So this is the 6th criteria. It does not meet this criteria that there are few or no side effects. But as we said, the side effects are obscured by intoxication, and they may occur very gradually, the same way as the old metaphor of a frog thrown into hot water will jump out, but a frog left in a pot and gradually turned up will not notice the differential, and the heat will stay there and hurt. And the other thing that makes it difficult for people to see this 6th criteria is that it can be masked by social feedback. In other words, there may be other people in their life who are giving them confusing messaging. For example, if they're hanging around with a group of friends or even family that are using the substance, then stopping the substance is akin to alienating that friend or group or family group. Those people may actually be enabling that individual. In other words, oddly, there are people who seem to feel as though their value in life is to support or be needed by an individual who has an active addiction. And so in order for them to have the role of the caregiver or the rescuer, they need the addict to be an addict. And in some cases, lastly, there are people who have been socialized from very early on in their lives that their biggest value is to be a victim or a user, a person who is not capable, not competent. And going back to Bandura's teaching, has never developed the idea of self-efficacy, has never come to understand that they could attack problems in their life, that they could resolve conflicts in their life, that they could display resiliency in the face of stressors or trauma. So many people have been socialized very early on that they should essentially kind of roll over and play the role of a victim. And this is very closely tied with some personality disorders, this idea that one goes constantly back to a very dysfunctional, often very immature pattern of behavior when forced with coping challenges. So When you look at all of these criteria together, one starts to understand the complex texture of addiction and substance use. One starts to understand why it can be very challenging to support the individual who's addicted, and can see how the drug is very compelling to the person. One can understand why in a society where the media and the commercial marketplace are constantly making drugs and alcohol available, treatment is not done in a vacuum. And you can also see how drug and alcohol use are somewhat distinct from other mental health disorders, and why they require a particular type of approach and a particular type of expertise.